for 5 minutes.
Thank you for the kind words, and thank you, Chair Eshoo and Ranking Member Guthrie, for convening this hearing. And thanks to the witnesses for appearing today on such an important topic. The COVID-19 pandemic has caused disruptions in almost every aspect of Americans' daily lives over the last 15 months. And thanks to President Trump's Operation Warp Speed, we have seen multiple vaccines authorized for use in record time and a return to normal life. Children have been greatly affected by the pandemic, as we have seen school closings, loss of activities, and limiting of routine social interactions, which have drastic impact on learning, on mental health, and on the social development of our children. With the authorization of the COVID-19 vaccine for children 12 and up, all of these activities must resume in full. Now, I'd like to take and turn to another matter of vaccines in children and the troubling drop that we saw last year in routine childhood vaccinations, particularly early in the pandemic. These were especially prevalent in the DTaP and the MMR vaccine rates, which prevent several highly communicable diseases. My question first is for Dr. Maldonado. Thank you for your testimony earlier when you laid out some of these issues and for highlighting the Strengthening the Vaccines for Children Program Act of 2021, which was introduced by my fellow physician, Representative Kim Schreier, myself, and our colleagues, Representative Butterfield and McKinley. In particular, I did want to focus on an issue that impacts doctors participating in the Vaccine for Children program. Dr. Maldonado, can you please discuss how the current program reimburses physicians for vaccines that protect against these multiple communicable diseases and how this poses challenges?
Yes, thank you so much, Representative Joyce, for that question. So currently, it really depends on at what level the provider works. So for example, if they're in a large practice or large health system, they're largely protected from the day-to-day work, but they still have quite a bit of paperwork to do. It only gets exacerbated if you're in a smaller practices or in a rural area where you might be the only provider for many, many miles for a large geographic region. What happens is these requirements are really broken down between federal and state requirements because there are separate payment funds flow for payment. So you may have private insured patients, you may have state funded patients, you may have federal funded patients, and the ability to streamline these processes would really take a big bite out of the time that providers have to spend after seeing their patients in completing all of the paperwork, hiring back office individuals to just do that work, which keeps them from seeing more patients and providing the care that they need. So the administrative and bureaucratic issues that streamlining VFC and CHIP, for example, really would go a long way to reducing the financial burden, the administrative burden, and increase the ability of pediatricians and other providers, such as family practitioners as well, to see patients face-to-face rather than to spend time doing a lot of the paperwork that is necessary to get this reimbursement.
Thank you for bringing that into the discussion. The area that I represent in South Central and Southwestern Pennsylvania, you described. There are many small practices in rural areas, and these individual pediatricians and family practice physicians are obligated to take care of these children and provide them with the necessary vaccinations. Finally, do you believe that the bill Strengthening the Vaccines for Children Program Act of 2021 will alleviate the concerns that you just laid out?
I do believe that this will take us a long way into addressing issues that we have been bringing up for many years now around the alignment of funds flow into practices, especially those that are already impacted even before the pandemic, and which has been exacerbated by current fiscal constraints that the pandemic has imposed on practices around the country. So this would have an immediate impact on the ability of practices to really gear up and get back into the business of taking care of children and keeping them safe and healthy. And then the long-term impacts would be important in keeping and enticing more providers, as I mentioned, to come into VFC and be allowed to participate in providing more care for children, giving them those medical homes that they really need.
Thank you so much for your answer. Chair Eshoo, thank you. I see my time has expired, but this is such an important issue. I definitely appreciate your indulgences and allow us to continue this conversation. Thank you.
We appreciate you on the subcommittee, Doctor. So